How do you get these heavy metals that we all have some of out of the body? We're able to push these out in the safest way possible through treating the body with minerals.
Girl, you've got questions. Questions about your body and how to feel good in it, about your hormones and how to keep them in check. Questions about your sex life and your whole health. Can you imagine having a best girlfriend who was also a triple board certified OBGYN? A girlfriend doctor you could call and ask or tell her anything. Someone who could show you how to live any stage of life, before, during, or after menopause, in a big, bold, and beautiful way. Well, friends, I'm your girlfriend doctor. I believe you are meant to flourish and shine, to embrace life and awaken to all its possibilities. Let's get there together. Welcome to our show. Well, hello, everyone. Welcome back to the Girlfriend Doctor Show. I am full swing in the middle of getting ready to bring out my book, Menopause. You gotta love the name, right? There is magic in the pauses. Menopause being a pause, or a transition, a transformation, a jumping off the cliff into something more exciting and exhilarating. I don't know, but there is magic in the pauses. And I love that we are pausing hormone imbalance symptoms. We are pausing hot flashes. We are putting a pause into irregular sleep patterns and a paused sex life, right? We want to reawaken, reconnect, and live the best life that we can live. So Menopause is the Food as Medicine book that I have out, a beautiful cookbook and programs, 5 different programs to help you break through a plateau, break through symptoms, and to pause the things that aren't serving you, to rest in the pause and heal and be empowered, and to power up into your best, most natural, most vibrant and invigorated self. So all that, please get your copy of Menopause and share with me how you like it. I'm excited to be leading you in a journey into the best rest of our lives. So with that said, my guest today on the Girlfriend Doctor Show, I invited, is Barton Scott. He is a scientist, an engineer, a nutritionist, and just a brilliant person. He has created a labs called Upgraded Formulas and nutritional supplements. His website is Upgraded Formulas, and they truly are. He's really used nanotechnology for absorption and a very thoughtful approach with hair analysis. And we'll talk about things in this show like, how can we make our thyroid function better? What are things that we can do to be empowered in our own health, to test, not guess. So join me in this discussion. I know you will find incredible, valuable information. Plus, I'm talking about 2 of my favorite minerals, iodine and magnesium. Yeah, we're going to get a little nerdy here, and you're going to love it. So here we go. Well, welcome, Barton, to the Girlfriend Doctor Show. It's nice to have you on.
Oh, it's great to be here. Thanks.
Oh, well, my pleasure. I met you at KetoCon conference in Austin a few years back, maybe, 4 or 5 years back. And you were talking about your formulas, the absorption potential of your formulas, iodine, magnesium, and also hair analysis. And I could just see that you're so passionate about what you do. And I have to be honest, I was like, okay, I can't take on one more thing at this point, right? I can't take on one more thing. But in the, on the sidelines, I've seen you doing your work and your education and your science and your research, and really like digging into this. And I saw you recently, what conference was it where I got your magnesium? Was that the biohacking conference?
Maybe so, yeah.
The biohacking conference. And you're like, you gave me your magnesium to try. And let me tell you, I had slept so well, had the best dreams. I mean, it was pretty amazing. I was like, okay, Barton, I got to bring you on. You got to talk to my audience about what you're doing and also the impact, and really like to understand, to help us
Mhm.
all understand, help my community understand the importance of minerals and why we should take them, when we should take them, and vitamins and minerals. So maybe
Mhm.
start there. Give us some background while you're, like how you got invested in this field and decided, okay, what's on the, what's out there is not good enough for what you want to see happening, the changes you want to see made, and you actually did something about it. So
Beautiful. Well, thank you for that amazing intro. I really appreciate it. It's been great to get to know you the past couple years, and um, I really did this because I had to. My mother was not doing well. She had been healthy all of her life, really vivacious, and I also had a lot of brain fog, and just low thyroid function from being a wrestler, from cutting weight and rest and just everything that sport demands. By the time I finished high school, I was one of the top in the nation in that, which meant I'd done it for 10 years, and my body had been stressed for even longer than that. And I did other sports like football and wrestling, and then I went through chemical engineering, and that was just really stressful, high demand, high workload. Um, Worked some through college too, and just was always going and loving it, but always going, always pushing. And I mean, by the time I was in my mid 20s or early mid 20s, I was helping her with her health, and she had had medication and surgeries, and all these things were piling up, and I could tell it was just not going well. Like, she was losing the vitality, it was draining out of her. And I spent a lot of money on testing, and some of the tests I got her to do with me. And then I also enrolled, one of my sisters, my dad, a few other, like my girlfriend at the time, her dad, like a few other people. So we had this small little case study going, and I could see that none of us were really changing our levels from test to test when it came to this hair analysis, which was, of all the tests I was working on, one of the ones that really stood out. It was the one that made the biggest difference for me personally. And there's so many other good functional tests out there that we both know about. And this was the area, though, that I kept looking at things, and I would go, okay, what can I change? And I would change what I could, or what seemed to be off. And a lot of tests, I was, maybe unsurprisingly, based on age and diet and everything I knew about nutrition already, I've been supplementing since I was 12, to be, achieving everything I could in wrestling. And, you sweat like 7 pounds at practice. You never get all those nutrients back, and then you just do it again. So it really was like self-induced hypothyroidism. And it's amazing that my body held up as long as it did, as well as it did. But ultimately, I realized, wow, I'm not absorbing these products. And I know that because my conditions are staying the same. My mind used to be sharp. I have debilitating brain fog. I feel like I'm going to lose my job. I feel like she's going to die if we don't fix this. I mean, the stakes were high.
mhm.
And ultimately, she did pass, and I knew that although I could be at peace with that, there was clearly something that needed to be addressed. And for me, having the training that I had, which is chemical engineer, you take before everyone gets super bored. The reason this is important is because if we don't absorb it, it really doesn't matter. It doesn't
Right.
matter how good we feel. I mean, to some extent, placebo effect, it's great that you feel like you're doing something for your health, but over time, that placebo effect is going to really wear thin
If
as
you're
you see
not
that.
testing, you're guessing, right? If
Yeah,
you're not
yeah,
testing, you're guessing. You've got to look, you've got to check. And we're limited with what we do with what serum labs show us about
mm,
our mineral and vitamins, right? And maybe we can talk about that
sure.
too. So getting into that. But first, I'm really sorry, for your loss. And
Mm,
I love the heart that you've come into this with, and the passion with which you've come into this with, and with such integrity. And I can hear that, feel that. It's one of the reasons that I like you and admire you and your work too. And so,
Thank you.
can,
Thank you.
continue
Yeah.
sharing.
Yeah, I mean, from there, it was really obvious to me that as I got healthier, I needed to work on a solution that could actually solve this problem. So we needed more absorption, and back in 2016, I figured out how to do that, and I made some discoveries around particle size, making things really stable as well, and yeah, today we're able to offer a whole line of mineral supplements that really go towards repleting the body, or replenishing the body, nourishing the body, brain, etc. And that's really indicative on how you show up, energy levels, just your ability to meditate, sleep well, have focus, have optimal hormones, all of these things, because I think we tend to forget that when it comes to hormones, what are the building blocks? The building blocks are primarily minerals and fats. And we need the minerals to activate everything. So we need to absorb them. So our process uses some nanotechnology equipment that's unique to us, and it's really incredible to see how much results people can have when they really, like you said, test, don't guess. So whenever, and believe it or not, we have that trademark now, and that speaks to how little testing I think there is, and how much guessing there is. And, I get it. People don't want to take the time, but there's such a return on investment in the time that you take if you have a great map, as you know, to know what you really need to do. It's like, oh, well, here's what you're missing, and it's okay. We're all missing some things, and that's going to change over time. But here's what we need to focus on. And let's focus on the 20% of this that's going to give us the 80% of more results. Does that sound good? It's like that. That's what I needed then. And I knew that I would continue to need that, because I could see already, even before I also became a nutritionist, that many different age groups here in this small little sort of case study, if you will, and we're all suffering from the same things, and our levels really weren't changing. So yeah, that's a bit of the story.
And so, and then with the importance of vitamins with minerals, and then we'll get into testing.
Mm-hmm. Sure. Yeah. So what's interesting is that, so I've done some long fasts. I've done 5-day, I've done 11-day, once because I needed to heal an injury. I, basically, partially pulled my hamstring, and it wasn't, I could tell it would be a nagging injury for a long, long time. So I used the stem cells coming out of bone marrow to help heal that. After about day 4 or 5, you get these stem cells, right? And they're just
with
healing
fasting.
Anything. Yes.
Yeah, with fasting, extended fasting. You just did a water fasting.
I did.
Increase in your body's own natural stem cells, which will go where they need to be to do the work it needs to do. It is anti-aging, but it does take you to that 4th, 5th day of that water fast to really get there.
Exactly.
More than women, but we don't really have good differentiating studies. Women most likely 6-7 days of water fasting. So we just have to look at that and see. Really waiting to get some clarity on that research.
Yes.
I haven't seen anything to really differentiate between male and female on that
stem
cell development, but it would be very interesting to look at and to consider. But so that it's, more extended, definitely even a 3-day fast gives you benefits, right? We get benefits from that. The next step push is that 4 or 5 day, maybe 5, that 5-day mark is key for women for sure.
I totally agree. Yeah, I think 5 at least for both men and women. At day 7, I checked in, and my goal was just to at least do 5 for that benefit. And I was using, to speak to that question, water fast, water and minerals. So knowing my levels, I was taking a few of our products, but certainly our potassium and magnesium. A lot of salt. I was taking our thyroid product called Peak Thyroid, and this gave me the energy. So I got a month's worth of work done in 10 days. the first 10 days of the fast. And
did you have to tuck away somewhere? Did you stay at your condo, or did you have to cook for your
yeah,
family? Did you,
yeah,
have to drive carpool? I mean, those things
yeah,
are
that's
definite defeaters in my life for sure.
right,
Well, I would
right.
just say, let's not looking at it as defeating, just looking at variables, and it's okay to have those variables. But
Mm,
I know Robin Openshaw would say she would do a 7-day retreat away from her family in an ashram and just stay there for 7 days to get her water fast. Otherwise, she couldn't do it. We each need to know our limits. I did a 5-day, almost like 5.5, almost 6-day water fast while I was moving to Texas and hauling to Texas, and that was really a challenge. That was really a challenge. And I had to add in unsweet tea, and but really being conscientious of that and that process. And when I'm fasting, and that was, again, that was a challenge. But I didn't have my kitchen. I didn't have, all those stuff going on. I did have to feed my daughter, but it was we were traveling, so a little bit challenging there. Just
mm. Yeah, it's interesting how much you notice about your habits around food and how you might lean on food for emotional support and how and to soothe, and how big of a part of
to
connecting socially.
enjoy,
Yeah,
right? Yeah,
right. Sure.
yeah.
Sure. So after a certain number of days, you sort of feel like you're living outside of society in a weird but interesting way, in a sort of like investigative journalism of your own life, because you have more time. You're not doing there's just so much time that we spend thinking about food, preparing, cleaning up, etc. And it was interesting, but not to fully derail there. It's I just thought I would mention that because just kind of in the flow of what we were talking about. I do find it's one of the most important skills that people can have, and I am writing about it. I've been writing about it since last year, when I had so many epiphanies around it, and I realized, wow, when you really incorporate, I chalk it up to the glandular function and being supported with minerals. And this was, to your question of minerals versus vitamins. The minerals are really activating all the enzyme pathways in the body, and that's their role and responsibility. And when they're not there, we get very little activity of those enzymatic pathways, because the only other thing that I'm aware of that can activate those are heavy metals that are similar to the minerals in some way, to some extent, and we get partial activation there, from what I understand. So the really fascinating thing is that we either all are or all should be pretty concerned about minerals, yes, and also heavy metals. So how, though, do we best protect against heavy metal accumulation? And what I found really clearly is that when we have the electrostatic charge across blood cells, we really protect ourselves against the accumulation of minerals. And they're sort of there, and they're plugging those gaps and filling those slots, so to speak, of activating the enzyme pathways. And because that's happening, the heavy metals are less likely to accumulate. And it's also just a great detox thing for people listening of, how do you get these heavy metals that we all have some of out of the body consistently and over time? And what I found is that each and we test for this too, we test for heavy metals, and we looked at the ratios of minerals to heavy metals. What we find is that we're able to push these out in the safest way possible through treating the body with minerals, specific ones. So mercury might be selenium, lead, sulfur, for example. Aluminum is silica. So there's just there's a lot of that we need to understand, because, for example, both mercury and aluminum are so commonly found in so many people. I mean, we just have such toxicity rates of those.
Well, Mighty Maca Plus is a superfood combination of powerful ingredients that really help give you energy, stamina, and not only that, it tastes good. So many people report reducing hot flashes, increased energy, better workouts. We have Olympic athletes, as well as, young adults, sport teams who are committed to drinking Mighty Maca. Let me tell you, This has been the one supplement that I recommend for my patients almost over 90% of the time. I give you 100% money back guarantee, and it is just fabulous. So check it out at dranna.com and use the code SHOW10 to get 10% off your first order. So that is true. We want to give more of the good and less of the bad. And one of those things that you and I both appreciate is the power of iodine. And iodine, will push. We used to have iodine in our food sources, much more so than we do now. It used to be in bread, for instance, and then they substituted with boron. And iodine competes with other heavy metals, right? It competes with boron. It competes with chlorine, for instance. And so those create toxicities to our thyroid gland, a huge, really a pandemic in and of itself, often because of lack of appropriate minerals, especially iodine, which is essential for pretty much every hormone receptor in our body. And let's touch in on that iodine. First of all, minerals with food, without food. When do we take our minerals?
Yeah, that's a great question. We can do either.
Please say it doesn't matter. Yeah, please say it doesn't matter.
I don't.
Thank you.
It doesn't. Yeah, it really doesn't matter. That I've seen. The body is so smart that if we put the right things in a way that we can really absorb, then the body is just going to go, oh, thank you, and it's going to do the job. So.
Yeah, I would agree too. Just preparing your body for that addition. Now let's talk about iodine as a preferred mineral. We call it mineral.
Yeah, element, mineral. Yeah, it's really interesting. Iodine, from everything I've seen, it's like you said, it's really important for everything you just mentioned. It's also antiviral, antibacterial, antimicrobial. For even what we're seeing, I've told people this for a while, and I heard someone mention it. Dr. David McCullough on Joe Rogan's podcast, one of the most recent episodes. I've been saying this for a couple of years
McCullough?
now.
Dr. Peter McCullough.
Okay. Yeah, Peter. Yeah, not David. Peter.
It's okay.
Yeah, so he was talking about using iodine as a nasal rinse to protect, and especially early days of having COVID. And I was like, finally someone is saying this. I feel like I've been saying this since day one, that like Germ-X, Purell, these are antibacterial. They're not really going to help. They'll do some harm as well. And then, iodine is like so affordable. We have so much research on it. We've used it for years.
ORs, right?
Yeah,
Betadine. We use betadine. We paint your belly, prior to a C-section, we paint your belly with betadine, much preferred to Hibiclens, which is another antibacterial used on the skin, but at least betadine has given you something back, right?
Yeah, exactly. Yeah, that's a great point. And, it's been used before they put needles in people's arms for blood work for years and years all over the world. Anyway, from everything of like using our dropper and like putting it in the nasal cavity, kind of breathing it back in, to just day-to-day use. Iodine is really amazing, but I think from a lot of the research I've seen that's been interesting is we take in such a small amount compared to what we should. It's really extraordinary that we don't all have hypothyroidism, be it based on that, because it's obviously one of the key minerals for thyroid function. And looking at healthy populations in Japan, looking at that eat 80 to 100 times what we eat daily of iodine, it's I think there's been some fear around iodine, especially if some people register hyperthyroid. Which,
well, that's the whole thing. And if you have thyroid antibodies, we are we eliminate iodine as much as possible, or reduce iodine below 150 micrograms daily. And there are those, how do you address that when you have Hashimoto's, for instance, and you are, and there are some proponents that say, let's get rid of the iodine completely.
Yeah. I've never, that's from if from a just the first principles effect, our thyroid to work, I've always understood that it needs certain minerals to make all the hormones, going back to where the building blocks of hormones. So, selenium is there, zinc is there, copper is there. I've always understood that we need some amount of this thing, and our thyroid may be underperforming because it doesn't actually have that thing. That's one of the reasons.
If you don't have the building blocks, you can't build the tower. I
Yeah.
agree. And I think like there's overdoing iodine
Sure.
too, but if you have thyroid antibodies, we got to look at the reason for those thyroid antibodies. Iodine didn't cause that.
Exactly.
Iodine doesn't cause it, and iodine is critical for every hormone receptor. If we have to eliminate it temporarily, in the case of Hashimoto's getting under control, we're really eliminating gluten, sugar, and getting rid of heavy metals and candida at the same time. And that's my treatment approach for Hashimoto's. And I will watch those antibodies trail down very, very quickly while supporting the hormones. While we're doing that, we have to support other hormones because, again, we're taking away a building block. And then contrary, I've used high dose iodine in treating breast cyst, severe fibrocystic breast, ovarian cyst, irregular cycles, hormonal imbalances. And I've used iodine in quite a few ways, with excellent results. Excellent results. I mean, fibrocystic breast, to go from painful, can't wear a bra one period, to not even knowing your period's coming the next.
Wow.
And that's also
Love
not
that.
just supplementing with iodine. It was also decreasing dairy, working like with my keto green way and doing these things, maybe adding adrenal support, like with my Mighty Maca, which I did put a small amount of pure iodine in there for, again, it's about hormonal balance. It's about giving your body the building blocks that we need to support your system. Now, your
Changing blood
iodine
pH as well. Yeah.
improving, right? Improving your blood pH, decreasing inflammation, decreasing acidity. So iodine, the unspoken warrior there, he really is the silent lead. So let's talk about your iodine formula, why that's different, why that's better.
Sure. So what's really important about ours, besides that it absorbs incredibly well because it uses the same absorption process that our magnesium, our selenium, all of our products use, is that so you get nearly complete absorption. It's able to get into the red blood cells. All of our products are designed this way to be able to be absorbed into the bloodstream, into the blood cells, without having to go through the digestive process. And because of that, it's just making it a lot easier for the body to absorb and utilize without having to depend on, okay, do you have any sort of gut issue? The likelihood of that not being the case is like incredibly low, right? For nearly everyone, right? And I realized that I wasn't absorbing those nutrients when I was testing like 10 years ago. And knowing that, wow, like I'm in my mid-20s, I'm fit, I'm eating a great diet, what gives? What else can I possibly do? If I have this problem now, how many other people have it right now? And will it get worse for me if something doesn't change? All of these seem like obvious answers. And I remember, so yeah, that's where it sort of leads us. Now, in the case of our iodine, I have a really large dose approach, and we have a dropper so that you can totally choose your own adventure. And but 2 droppers will be 5 milligrams, and we have 60 doses per bottle of that high dose if you choose to use it that way.
And is it sublingual?
You can do it.
I know I've used it.
Yeah. So and it has no taste.
Or you mix it in water, right, and drink
You can
it down.
you can do that. To your point earlier about chlorine, I always tell people with all of our supplements, you want to mix them with water and dilute them. so that you don't taste them. And that could be, you know, any other flavoring if you're putting it in with, you know, some electrolyte powder that you like, or lemonade or ACV or whatever it is. You can do that. But the interesting thing with our iodine sitting right over here, looking at it, I just took some, you know, this morning, is that I've seen a noticeable effect, and I've heard people write in about this too, is that they really, it has no taste. So that really helps, because a lot of them taste absolutely horrible. So that was interesting to sort of figure out. And then it also helps with cold sensitivity pretty noticeably, because it's a large dose and because it's really well absorbed. So you'll notice after a while you become more vascular. You'll see it in your hands in a good way, in a healthy way. And you'll notice a correlation between that and a lot of mental energy and focus and things like that. Now, for me personally, to fix my iodine deficiency, that took a better part of a year, something like 9 to 11 months. But at that point, I was able to go down to the springs here, which is, you know, in the 60s year round, and be able to hang out in the springs for like an hour. And I used to not be able to really even get in. And it was, you
That's
know,
interesting.
part of that thyroid. So granted, that was a whole approach. That's not just supplementing iodine. That was all the things I'm doing, and all the other minerals too. But I know that was a big part of it. And
Yeah.
I know that we don't, for a normal, healthy person, we do not eat anywhere close to the amount of iodine that we should be consuming on a daily basis, because like you said, we used to have foods that had it. Now we don't. Japan is healthier for a lot of reasons, and it's not the only one, but they do consume about 100 times more iodine than our RDA of 150 micrograms every single day as a population, because they have so many sea vegetables. And it's just something that
it's not just seafood, sea vegetables, right? Our nori, our sushi, our seaweed.
Right.
You were starting to say something about chlorine. Like if there's chlorine in your water and you're diluting iodine in that chlorinated water, is that a problem? I would think so.
Yeah, it's a problem. Chlorine, fluoride, these are all things that can interfere with iodine absorption. So
yes, and I forgot to mention fluoride. And oftentimes in working with patients, when I start supplementing with iodine, we definitely would see some, like maybe some skin eruptions, some acne, and it's like, okay, it's pushing out some toxins, going to push them out any way they can. Bear with it. Your skin will look better than ever when you're done. But we don't want to go through that. But it's just something to realize, oh my gosh, that those toxins have been stored in me. And now you do the hair analysis. So let's talk about the hair analysis and why you like. I've always, you know, give me blood, give me urine, give me stool, I'm going to check it all, right? Give me saliva, I'm going to look at it all. And hair analysis, I'm like, well, you know, explain that to me. And I have had patients bring in hair analysis in the past, and I'd be very, very skeptical. And then you said, no, you've really got to look at hair analysis because it's giving you another piece of information. I always say to my patients, look, we're going to check every body fluid you have at some time, because it gives us information. So when you said it that way, that just reinforced what I do, but I wasn't looking at the hair, but yet I'll look at the skin, I'll look at the tongue, I'll look at the conjunctiva of the eyes, the nails. Why wasn't I looking at the hair? And so let's talk about that, because definitely you have skeptics out there like me saying, why would you even? But when we put it in this way, like every substance in our body is telling us something. And then let's not even begin to mention the energy of our body, the energy that we're putting off. So energetic testing. All right. Yeah. So back to hair. I'm no longer critical, ladies and gentlemen, of hair analysis. I am critical of hair analysis. The way you do it makes the difference.
The way you do it, for sure. And also the interpretation. The person interpreting it has to be trained in it. And they either need to have studied quite a while, or they need to have gone through our course, or we have a practitioner course. And it's really empowering, I will say, when you start to really figure it out, and you start to see that, for example, you sit across, either like across the table or over the phone with someone, and you can even, I guess in the case of the phone, we do this all the time with our consultations. People will be sort of amazed when we get done listening and they're like, wow, first of all, never really been listened to in my health before. I'm just now realizing that. And then B, this is kind of blowing my mind because you're asking me about specific things like, have I not dreamed in a long time? And I'm wondering how you might know that. And then when you do that 8 or 10 times with people, as we do in our consultations with all the nutritionists I've trained and that take calls for us, is that you start to realize, wow, well, if they could peg 8 or 10 of these things just so certainly for me, like the test must be accurate because we're over the phone. We're not even face to face. There's no, they don't have any other info on me. So you're looking at these results and you're able to see things like thyroid function, adrenal function, metabolism, hormones, and it's really powerful, because if you were to go and do a thyroid panel, which I recommend people to do, obviously, then you'll see, if the blood work said low, you will be low on the hair test. Now, the hair test doesn't have any marker where it comes out and says, hey, this is thyroid function. But there are plenty of things that we look at that tell us without a doubt, this is where you're at. And I've never seen that be wrong. Also with our labs that we use, I've sent many samples to both labs at the same time, and they always come back within 5% of each other. Which obviously this sample itself is going to be a little different. So you'd expect some difference. So I feel really good about that. And proof's in the pudding. If you can just magically identify things for people without ever meeting them, like, I mean, there's a lot of validity there. And when you see the results go up in your next test and change based on your supplement protocol, it's pretty empowering.
Yeah, it's an easy, non-invasive guide, except we talked about beforehand. I'm like, I know I did a hair analysis test. I had to take a chunk of my hair, and you see how long my hair is long, right? Mm-hmm. And so I think that's been a few years now, 4 years now. So I think it's finally grown out. I'm like, but you said there's less invasive ways to do that, because I don't definitely, and a little bit goes a long way. I don't have to take a chunk of my hair. So.
Yeah, the way I tell people to do it is, imagine, you have these, like 3 fingers on each side of your head, and you do like 3 dots down each side, the nape of the neck. Now, if you have long hair like you, it will absolutely never show, and it really shouldn't show for anyone. We can do underarm if people have underarm, or pubic, or guys with chest hair as well. So there's if you spread it out and you do small spots and you're sort of patient, the first time you do it, it might take 10 or 15 minutes, which is still less than the time that you spent driving to get blood work done. And you still don't have to have a needle in your arm, which a lot of people, as you know, will just procrastinate on blood work because they really don't like doing it. They really don't like doing it. So this is just giving them another option. I still want them to go and do their full panel multiple times a year. If you do this quarterly, you'll have a map that will they'll serve you very well. And I've seen that firsthand for so many people. So that's really, really key. Yeah, we have videos and instructions on the site that really help. And we're really looking for that inch or so. It could be 2 inches, but any 2 inches or less closest to the scalp, because that's the freshest data, obviously, that we're going to have. And that will give us anywhere from 6 to 8 weeks of data. And then we retest, quarterly, every 90 days, and we'll see that things are changing, and you'll get to continue to steer the ship, so to speak, accurately, versus looking at the map once, so to speak, and then going below deck, and then the whole ship makes one big circle, because, as you know, testing is pretty important.
And I think being able to check an intervention yourself, that is is key. So that's where we say
Mhm.
test, don't gas. Now let's talk about your magnesium, because I definitely recommend, I have a great magnesium, my magnesium L-threonate in my Better Brain and
Mhm.
Sleep formula. It is amazing. And I definitely see improvements in serum labs. And but when I took, and I'm used to that one, right? But when I
Mhm.
added yours into my regimen, it was like, wow, the dreams. And I was like, I was knocked out. I mean, maybe you're like, oh, just take one. So what did I do? I took three. And I'm telling you, I mean, it was a really big difference. So let's talk about your magnesium and that nanotechnology that you use for that, and what
Mhm.
makes yours different.
Sure. So it's really the ability to absorb that product. As soon as you break down the capsule, you don't have to digest anything else. It's like it's straight into the bloodstream, and then the body's able to make a lot of melatonin. The body's able to make serotonin during the day, and then leftover serotonin gets converted into melatonin in the evening. So all of that is really really important for healing, for stress reduction, for cramps. We have a liquid formula, same product, just in liquid. And I've seen firsthand N equals about 12 or so people that have had cramps, some like incredibly severe cases that I could talk about. And the cramp has gone in
Are you talking about
three,
menstrual cramps, muscle cramps, Charlie
both
horse?
actually.
Okay.
Yeah.
Yeah.
I've
All right. Let
seen,
me get some from my daughter
yeah,
here.
yep. It's so, I mean,
We'll
your
add that.
period should not be painful, as
Should
you know,
not be,
right?
should not ever
Yeah.
be. Right.
And it's just another way that your body's speaking to you and saying,
Yes.
hey, there's something that needs attention here.
And when we're stressed, we're sucking up our magnesium, right?
Yes. Yes.
We're just emptying out that bucket of magnesium. And too, it's true with our stress, like being in university and working. My daughter Amira is in university, and she's on three
Mhm.
organizations and she's working. And so you think, okay, all of those things, and you want her, to cook good, healthy meals. And we were batch cooking yesterday. We're doing a Keto Green 16 challenge in my community. We're working through Keto Green 16, and then Menu Pause comes out in April. Then we'll be doing the 6 day plans. There's 5 different 6-day plans to change things up. We're really
Cool.
focusing on balancing the herbs, the spices, the minerals, and we're just having a great time. And
Mhm.
food is medicine. I was thinking, like, it's hard to cook for yourself often. So when you batch cook with friends, I'm like, why don't I do this more often? Right.
Right.
Brought my daughters over. My cousin's going to come over for our next batch cooking. I mean, it's a party, and everyone's chopping something different, tasting what each other's working on. And it's really a great experience, because food is medicine, and we want the right food so that our body continues to absorb the nutrients that we're getting from our food. And when it's not, we can we can eat the healthiest diet, right? We can supplement with the best stuff, right? We have to be able to absorb it. So like having the technology that you've incorporated into your magnesium healing,
Mhm.
that's key. So that while we're healing our gut, while we're doing this, we can also get the nutrients that we need. And magnesium is important for collagen production. It's good for, I mean, important for hormone production. So you really nailed it with the two of the most important minerals that I like to use as therapy, as therapeutic
Mhm.
interventions, and that is magnesium and iodine. I will tell you,
Mhm.
when I was pregnant in 2007, I was in Germany, and I was bleeding every day of that pregnancy, and I had lost a child, and I was worried I was going to lose this child.
Wow.
And I slept 3 hours a night, and I went to the best obstetrician gynecologist, actually the chairman of the Munich hospital, chairman of OBGYN in the University Hospital in Munich. And he said, he wrote on the prescription pad, magnesium.
Yeah.
That is unheard of in the United States.
Wow.
First of all, we get it over the counter, but
Wow.
there it's part of the the natural medicine in Germany, from the German, the what's it
Just
called? The
new
nature
medicine. Yeah. Yeah.
monologues. Yeah.
Mm-hmm.
So, but it's that magnesium
Wow.
is what he wrote for me. And I
That's
was just
amazing.
like, here I am, Emory University trained, very integrative at that time, even because I grew up with
Sure.
food as medicine. But to have that prescribed to me
Mm-hmm.
as magnesium, that was really, really powerful. And
Wow.
yeah,
I
so,
love that story. Wow,
oh,
that's so
good, right?
powerful.
Well, there's a
And
little
like
edge to it too, because a little
there's
funny
so
story.
much. God, yeah.
Yeah,
Well,
there's so
there's
much good stuff about that, but how important that is as a medicine, right? It's important and able to use it. And I have never in my all-time testing of red blood cell magnesium seen anyone with too high a level.
right.
I've never seen anyone with too high a
Yeah.
level of magnesium. So I am challenging myself to be the first.
Mm.
However, have to remember
Okay.
to take my supplements. Okay.
Sure.
So
And we've seen people's RBC jump like super quickly from like low threes, fours to like ideal like you know 5.5 or so roughly,
and let me
really
just
quickly
emphasize
like
that.
in the first bottle like
Yeah.
just boom,
Yeah.
and that usually takes a while. That so.
Let me emphasize for my audience, when you go get a magnesium part of your testing, they often do a serum magnesium. You have to
Mhm.
ask for a red blood cell magnesium. That's in a separate tube, typically a blue top tube, and it's processed a different way. They're looking at magnesium in the red blood cells versus in the serum versus in the blood.
Right.
So we're looking in the red blood cell for magnesium, and we want that level to be 5 or greater. Normal
Mhm.
range is what, 3.5 to whatever, but
Yeah.
5 is the minimum that we want to
Yeah.
see it. And I just did mine. I bumped mine up. Mine used to be in the low threes, low fours. And then
Mhm.
I've gotten up to 5.1. And just with this stressful cycle, it's at 4.8 or 4.9 right now. And I'm like, oh boy. All right, let's get Barton on the phone. Hey, Barton.
Yeah.
Hey,
Beautiful.
man.
Yeah. We will send you some for sure.
Let's talk. Okay, so tell our audience, you've got a coupon code for our audience, and
Mhm.
where to get your hair analysis and your formulas, and to connect with the information that you're giving. Of course, you're active on Instagram. You've got some great information there, and certainly
Mhm.
iodine to boost our immune system, to use as part of our nasal wash, magnesium to increase our neurologic function, decrease cramps, keep supporting our adrenal glands, and test on gas, right? Let's look at blood, let's look at red blood cells, let's look at urine, let's look at stool, let's look at saliva. I mean, in my book,
Mhm.
The Hormone Fix, I talk about these
It's a good
different
book.
testings.
Mhm.
So and then let's look at the hair, right? Let's do a hair analysis. You can do it from your own home
Yep.
and be guided by, Barton, your team will guide them with the interpretation
Mhm.
of the results. But
Yep. Yep. We offer the test. I always say get the test and the consultation. It's just without a great consultation, we wouldn't have been talking here today, because I would have went, oh, I have a minor in chemistry. I know how to read this test. Like, who are you kidding? You know, that I wouldn't know. And there's just so many things, like, for example, hidden copper toxicity that someone that's not incredibly well trained will never catch. And you won't catch that in blood work either.
well, often it's the pattern of
It's
the
the pattern.
labs, right?
Yeah,
Yeah.
yeah. It's the pattern, and there's it's the relationship between all these minerals too. It's not just the individual levels. It's really the ratios that are much more important. So yeah, we have all of those and so many other great products that people can use as tools to help them with achieving better results and feeling better and doing everything better, all the things you mentioned. So thank you for that. That's really gracious. And people can check out upgraded formulas. The code there is Dr. Anna 15. So DR and then A and then A 15 and check out. And yeah, so that's good for your first use on the site, just because we can. And my goal really is to empower people to have more power of their own health within their own hands, and being able to order the test, go through a consultation. You don't need anyone's permission to do that. You don't even need anyone's permission to have our course and to understand it yourself. You don't and I've always felt that so strongly. I'm sure you do too, that way about health. Is I want to
Barton,
help
Barton,
people, but I
Barton.
want to give them the tools. I want them to be empowered. I want them to, Yeah.
Yeah, I have a very educated MBA/CPA, and really like is a timid about supplementing without the permission of his internal medicine doc. I'm like, you are so intelligent, and guys, these are university docs, brilliant. 5 minutes with the patient. And in COVID times, look, if you're sick, I don't want to be in the room with you. I mean,
Right.
so it's
Sure.
true. Why? But, I mean, it's really important to have this time to be empowered, to use this information to take control. Thank you, Barton. Thanks for being
Beautiful.
on the Girlfriend Doctor Show. We will be sharing this. I encourage our audience to share this far and wide and deep, and check out upgradedformulas.com. Use the code Dr. Anna 15, Dr. Anna 15, DRANNA 15 to get 15% off your first order. Try it out and let me know. Let me know how you respond to it, what it feels like for you, and comment below this. Hopefully you're watching us here on having our fireside chat, virtual chat here on the Girlfriend Doctor Show on YouTube, and comment below. We will address those comments. We will address those comments. So I thank you for being here, Barton. Upgradedformulas.com.
Yes, that's right. Well, it's been so good being on with you, Anna, and I'm looking forward to seeing you here in Austin soon.
Yeah, I look forward to it too. Thank you, Barton.
Awesome. Thank you.
I love it when I'm on the same page with especially a nutritionist, right? There's different ways to look at how we heal our bodies, and our life's experience, as with Barton as with mine, can take us on a trajectory that we didn't expect. And I think as we, take our next right step, what's the next right step? Maybe it is more information. Maybe it is trying a different form of magnesium, or adding in iodine. Again, I wouldn't recommend iodine without checking and knowing your thyroid antibodies are nice and low. And so normal, in other words, or optimal. And so that's just something to consider. And then if we need to, working with a provider to safely increase iodine level. Because again, essential for all hormone receptors in our body. And with that said, what resonates truth to you? What's your next right step? And how are you feeling empowered in your health? I do want to congratulate you and pause to honor that. There is magic in the pauses. And we can take a pause and honor that we're taking the next right step that is best for us. And that is finding the information, taking the next step to learn more about what our body is doing with our experiences in our life, with what we're eating, with what we're putting on our skin. What is our body doing with it, and how optimally healthy are we, and where can I target the smallest step to make the biggest difference? And I kind of look at health as this upside down pyramid. At the top of the pyramid, we have all these diseases: high blood pressure, diabetes, cardiovascular disease, cancer, just name it, right? Autoimmune diseases. And it's at the bottom of the pyramid, if it's on its head, if we make a change here where the change started, it started here, a abnormal cell mutation, a breakdown in a cell membrane, a nutritional deficiency, a toxin or parasitic invasion, whatever it may be that caused this change. And then it just continues to spiral, build up, and you've got all these symptoms. It may have started as a headache, it may have started as irregular cycles. It may have started as aching joints or pains, and now it's these diagnoses, right? And if we make that change at the top of the pyramid, which is at the bottom, we've turned the pyramid on its head, right? At the tip of the pyramid, if we make a change there, then all of these resulting problems go away. So, and I've seen that over and over again. I want to make the smallest changes to have the biggest results, and address the underlying reason that our body's gotten out of whack or out of balance, to begin with. So with that, I thank you for being here on the Girlfriend Doctor Show. We are here to support you. I'm grateful for my team that helps make this happen, our customer service team. If you have any questions, don't hesitate to reach out to us through, through social media, through our customer service at team at drannakabeca.com. And the pillars of good health and our platform is to nourish our body, awaken our mind, embrace life and connectivity, and to shine from the inside out and the outside in. So thank you for being here today on the Girlfriend Doctor Show. Please share this episode. And remember, there's no such thing as TMI. You can ask or tell me anything. Till next time. Thank you for watching this video. Be sure to subscribe to my YouTube channel here and get those notifications, and comment below. Let me know your thoughts, what you loved, and what your action step is.